Hello everybody, hi. Okay, it's about 2:55 here in Lima, Peru. So this transmission, it's going to be in English. So if you want to make questions in Spanish, si quieren hacer preguntas en castellano, yes, of course you can make them, pueden hacerlas. Pero la transmisión del día de hoy va a ser hecha en inglés. Como as we had promised to all our followers around the world, especially many people living in the United States, this transmission is actually meant to be for them, okay? So we can actually answer all of the questions you have, okay? This is very important for us because we can find a way to contact you all, okay? But as I was saying, if you have questions in Spanish, si tienen preguntas en castellano, you can make them in Spanish, pueden hacerlas en castellano. It is not a problem, okay? So we're gonna have a little wait until it's 3 p.m., okay? So I'm going to be saying hi to some of the people that are following us right now, and we are actually in the 3 platforms. We are in Instagram, in Facebook, and in YouTube Live, in the 3 of them. So you can follow us in any of them. You can make your questions. Today we're actually going to talk about Katherine's case. The last YouTube video we put up on YouTube. This is one of our patients that had surgery on December last year, and her case was posted up on TV. I think it was on January or February this year, actually, okay? So she's one of the last cases that we had. She had a very, very nice result. So I really think you should watch it. We posted up some pictures of her on the Facebook channel, okay? So it's really nice. So we have some people here following us from Ecuador, from Houston, Texas. Hi, how are you? If you don't speak Spanish, you can actually make all your questions in English. So this is the intention of this video, okay? We have Katherine Shepard said, I love your work. Thank you so much. Someone is posting from Canada. Well, we're so happy to have you all. I mean, this is like, we're worldwide. Actually, we have patients who come from every single corner of the world, and we treat them exactly the same as we treat Peruvians, okay? So let's say hi. Okay, we got 2 minutes. Hello, Alvamor, hola, hola. We'll have more people that are joining us. Okay. Okay, we have, you can say where you're from if you want to. We're not going to say names. Okay. Okay, we have some anesthesia questions. Okay, I'll write them down so that we can actually answer them. Yeah, we have an anesthesia video. Well, it's in Spanish. You can watch it. There's no problem. Yeah. Oh, yeah. This girl is from Peru, but she lives in the United States. Okay, good. She lives in Houston, I think. And okay. More questions about fat transfer. Okay. Okay, sure, yeah. Yeah, you just leave your questions and we'll get to them in a minute, okay? So first we're gonna talk about Katherine's case. It's almost 3 p.m. I think we can start, okay? So first of all, we're going to talk about this case. I was saying Katherine is one of our patients. She's a young mother. She actually had her surgery last year in December. I think she was one of the last cases we operated in 2019. And then her case was posted on our national television, because this is a show that goes on national television. Apart from going in the web, I mean in Facebook and Instagram and everything, it's on TV, okay? And I think it was like at the end of January that her case was shown, okay? So after the case is shown on national TV, then we can go showing the case in all our social media. Okay, so she's a young mother. She had, I think, one baby, but after one single pregnancy, she ended up with a very, very dreadful abdomen. So her skin was very, very flaccid, and she could no longer use a two-piece bikini to go to the beach. So that was her major problem. Okay, the other problem that she had was that she had never had such like large breasts, but she wanted to have more. So we offered her a breast augmentation with an implant, with a very nice implant, which is called Motiva. Many people don't know about this implant. It's an implant that is manufactured in Costa Rica. We actually had the chance in the month of February, just like 1 week before everything of the COVID-19 spread it out. We traveled to Costa Rica to see the manufacturing of the implant. They have a very, very large setting over there, and they make these implants which have very, very nice technique. And it's a very good process of manufacturing. Why? Because actually they don't only comply with all the standards, but they're in constant renovation and finding new technology to make implants better. Okay, since like breast implants is probably one of the first or second plastic surgery procedures around the world. So what we're trying, not only plastic surgeons but implant manufacturers, is to find out implants that are safe for women. Okay, which is very, very important. So if we're going to continue putting implants for a long time, we need to give patients safety. Okay, so this is very important. And I think Motiva is one of the probably, I think, one of the implants that are seeking to get to that, to get the best implant in the world. Okay, so we have it here in Peru, and we can offer it to our patients and to patients obviously that come from abroad. Okay, so we offer her 375 cc's implant, and you can see, if you've seen the case, and I really tell you, you should watch it. If you see the case, you're gonna see that she is short. She might be like 1 meter and 50. She's not tall. She's not a tall girl, and she's thin. So a 375, if you see her result, is actually, it looks really good, and it looks something that it's not so big, but it looks anatomic, and it's something that looks really nice. So as how to choose the right size, we always talk about the anatomy of the patient. This is very important because patients sometimes have strange ideas, okay, like, how am I going to choose my implant? Let me go over the internet and find out many girls that are showing their breasts in bikini. So I think I want this picture. Let me try out this picture. How would I look with this? Okay, it is very important that we find the anatomy of the patient, okay? The anatomy is the basics. If we don't start with the anatomy of the patients, we're not going to go long, okay? So in the case of Katherine, she had actually probably more or less an intermediate thorax, okay? An intermediate thorax, which is actually for a thin person, between 300 and 400 cc's for a breast implant. This is most of what the best implants she can get in those sizes, okay? So she actually wanted, I think, a little bigger implant. At first, when I saw her, I thought she could have a 250 over 300, but she said, no, I want something that looks out, that is a little bit bigger. So we decided to go for the 375. In her case, because this is also depending upon anatomy of the patient. In her case, we decided to go beneath the gland and not beneath the muscle. Okay, so, and this is important for international patients because we're gonna have patients that go to doctors in the United States and go to doctors in Europe and in Japan and in different places, and they're gonna say like, why is Dr. Martinez putting implants below the gland? Why isn't she putting all implants below the muscle? Okay, so this is an anatomic thing, and not all the people, not all doctors think the same way. We have different experience, and we sometimes act not only because of medical knowledge, but also because of our own experience. We take experience from around the world. We take experience we find in textbooks, in magazines, conferences, etc. However, we finally stick to what is the best result in our hands. Okay, so this is very important, because some doctors can say never put the implant above the muscle, but the result maybe not always is going to look nice. And what a patient wants is the breast to look very natural. So if I'm going to put something following some kind of anatomic principles, but at the end it's not going to work out aesthetically for my patients, then maybe I shouldn't be doing it. Okay, so we have to be like really serious with this, because at the end what matters to the patient is how it looks. The patient maybe doesn't even know like how many hours I spent in the operating room doing her surgery, or how risky or maybe how difficult it was. At the end, the patient is interested in the result, in the final result. And natural results are what's more important for patients in this time. Okay? So in her case, we put the implant below the gland, above the muscle. Why? Because she had a saggy breast. She had a drop breast. This is why we chose this type of procedure, okay? Which is very important, okay? So if you want to know, like in your case, in my case, what type of procedure in breast implantation I would need to have, you have to send us pictures, so therefore we can choose and see what would be the best option for you, okay? So after breast, we talked about the abdomen. So in the abdomen, she had this fluffy belly with all this stria, and she had a belly button that was hardly seen, okay? So what we decided to do was an abdominoplasty. Now if you see her pictures in the pre-op, and you can see them because in the case, in the video, you can see all the pictures, and some of them that I put in the Facebook before the live stream. So you can see she is actually a thin person. She's not a fat person. She doesn't have a lot of fat in her body. And she has a very nice contexture. She has a very nice anatomy. However, she had some fat deposits, maybe around her waist, around her arm, around the side of her axilla and her breast, which actually were making her not showing her anatomy, okay? So this is important because we need to get out these little fat deposits to be able to give her a much better shape. Not only cut off all the skin that is fluffy, but also be able to form her. Okay, so this is very important. We don't only do the abdominoplasty, we do liposuction to all the areas that are around the abdomen. And what do we do in the abdomen? In her case, we did a high definition, okay? We did a high definition lipoabdominoplasty. And this is very important in her case because she is a patient that can actually be a candidate for this type of procedure. You want to show your muscles. You want to show your high definition muscles, your rectus abdominis. You want to see yourself like if you go to the gym all the time, you have this splendid muscles, you can do a high definition procedure. But this is not for everyone, okay? Not everyone can have a high definition procedure. Why? Because if you have a lot of fat, believe me, you cannot have this type of procedure. It's not for you. The amount of fat is too much. That skin is not going to shrink the way we want. So we have to select our patients, okay? So this is why it's important for you to watch her case. So maybe what many people do, and what most of the patients that I talk to, they say, I watched this video, I found myself looking alike. So therefore, I think I can have the same procedure and I'm gonna have a similar result to the girl that I saw in the video, okay? So this is important. If your body looks like the girl in the video, in this case, Katherine's, then maybe you're going to have a similar result. If your body does not look like that, you might not have a similar result. Maybe you need 2 procedures, or maybe you cannot go for a high definition procedure. Maybe you can just go for a straightforward liposuction or a straightforward lipoabdominoplasty, but without high definition. Maybe the solution for you, if you have too much fat, it's to go under a lipoabdominoplasty, let's say in about 2 or 3 months from now. And then after 6 months after the first procedure, you can go under a high definition liposuction. But it's a 2 times procedure, okay? Why? Because we're gonna talk about safety first. And safety is very important for our patients and for us. We wanna sleep at night, okay? We don't wanna have emergencies. We don't wanna have people running around with necrosis, with skin necrosis, with bad results. No, we want people to be happy with our procedures, okay? So this is very important. We're gonna talk about safety. So some people that have a lot of fat, it's not the case of Katherine, but I'm gonna tell you this because many people think that everyone can get the same result, okay? And this is not true. This is going to depend on the anatomy that the patient has when they come for the first time, okay? So I'm seeing, and I'm gonna go out a little bit of the case now. We've talked for like about 10 minutes. We're gonna talk about the case 5 more minutes, and then we're gonna start answering questions, okay? So we talk about with many people that they send their questions, they send their pictures over Facebook, over Instagram, and we think that they don't really understand like the amount of fat that they have in their bodies, okay? So one of the things that we ask is, please put some kilograms down, okay? In order to have the best result able in this type of surgery, you need to put some kilograms down, okay? So let's say that you weigh like 90 kilograms, which in pounds will be like 180, more or less, okay? And you're like 1 meter 60 or 1 meter 65. You've got like 25 kilograms, like 50 pounds more than what you should weight. We're not gonna say that you're gonna lose them all before surgery, but at least you should lose half, okay? You should lose like half of it. If you lose half of it, your result is going to improve dramatically, okay? And you can avoid a second surgery. Why? Because I'm saying that if you have a lot of fat, and you qualify for a plastic surgery, you can do a lipoabdominoplasty in 2-3 months from now, let's say. And then after that surgery, you're gonna have to go under another liposuction after 6 months if you want to have the plain and nice abdomen that Katherine got. Why? Because she didn't have so many fat. She had a little bit of fat. Most of the things that she had in her abdomen were this flaccid stomach, okay? This flaccid abdomen. So we had to cut the skin, but in her case, that she doesn't have a lot of fat, we can do this high definition procedure, okay? But we can't do it in people that have a lot of fat in their panniculus. Panniculus, we talk about like the thickness of the fat underneath the skin between the muscle and the skin. If it's like this, I can go like that and I can show your muscle. But if it's like this, I cannot take it like that. What's gonna happen? You think what's gonna happen with with the skin, if I take all this fat out, it's like this. Let's say the thickness of your fat is like this. If I take it to here to try to show the muscle, it's going to go bumps, okay? So it's very important that you understand why we choose as doctors to do one procedure on top of another one, okay? So this is very important. So now we're gonna go to some of the questions, okay? Let's talk about a little bit of the post-op, okay? The post-op for a lipoabdominoplasty, it's basically 1 month that you actually have to be in bed. The only reason why you have to stand up and go to the doctor is to have your massage, okay? If you don't do any massage, you're going to stay calm in bed. But if you start going to work and walking, then you might not gonna have a very nice result. We talked about this in other videos, which we talked that people that do not obey and start going out at the 2nd week after the surgery start having fibrosis, okay? You can check that up in some videos that we did before and some lives that we did before that are in Facebook and that are in Instagram, okay? But generally the post-op period is actually 1 month, okay? And you have to do your massage. Massages are maybe twice a week or 3 times a week, depending on the frequency that the cosmetrician chooses. And they will talk, the patient will talk with the cosmetrician, like, to whether they decide let's say, what frequency they're going to have. Okay, after 2 weeks, we take drains out. We do some checkpoints to see that everything is okay. At 1 month, if you're coming from abroad, the patient can go back to her country, can go back to work, but they cannot do exercises. Exercises have to be done actually after 2 months or after 3 months, when everything is settled down, there's no more fibrosis, everything, the skin is normal, nothing is hard, and that's the way it goes. Why? Because we have to let the surgery settle down, let the inflammation period finish, okay? So this is actually very important, okay? In this case in particular, of Katherine's case, she actually had more than a month after, I think it was like 1 month and a half. 1 month and a half, yeah. So the cases can vary, okay? But more or less, the result you're seeing, it's about 1 month and a half after the surgery day, okay? Okay, so let's answer some questions, okay? If you have questions in Spanish, si tienen preguntas en castellano, pueden hacer las preguntas en castellano. You can make questions in Spanish or in English. Da lo mismo, no hay ningún problema. Vamos a ver aquí en la plataforma recuerden que estamos transmitiendo a través de las 3 plataformas y estamos viendo, vamos a ver dónde tenemos la mayor cantidad de preguntas. We're going to see the questions, okay? Nos saluda Verónica Martínez desde San Luis Potosí. ¿Qué tal? ¿Cómo estás? Yesenia Terrero desde Bélgica. Marlene Aquesolo nos dice que es nueva. Bueno, hola Marlene, ¿qué tal? ¿Cómo estás? Charito Velarde desde Canadá. Ruiz Verónica dice, do you go to another countries or just in your countries? Well, you know that this is an answer for her, for Verónica Ruiz. We only do surgeries in Lima, Peru. This is the only place. We do not go to other countries to do surgeries. We once tried to go to a different state. We went to Huancayo once. It's a different state in Peru, okay? But we had to go every single week because we had to look over the patient that we had surgery on them. And it was not possible. So we stopped doing it. We decided that it's much better to have only one place where everyone can come and they're gonna have all the treatment done, and then they can go back after they finish all the procedure with everything settled down and okay. This is why we tell all the patients that come from abroad that it's very important that they stay in Lima for at least 2 weeks. 2 weeks if they're gonna have some facial surgery like rhinoplasty, blepharoplasty, maybe lips or stuff like that. But if they're gonna have liposuction, abdominoplasty, breast surgery, it's 1 month, okay? This is very important. I know it's hard because sometimes I only give vacations for 15 days, but it is very important that, that actually they have 1 month, okay? Let's see if we have some other questions. Janet Lorena Coronado nos pregunta que espera salir de esta situación y por hacer un arreglo. Todos esperamos que la situación del coronavirus termine. We all hope really that this situation with coronavirus ends up. We hope that the vaccine is developed. We don't know what's going to happen. Just today, our president told us that we're going to be confined for 2 more weeks, which was expected after seeing the amount of cases that Peru is showing. So we really hope that this finishes. We don't know what's going to happen, okay? But sí, esperamos que todo termine pronto. Karina Ortiz González nos pregunta dónde estamos dando citas. Karina, en este momento nuestras citas son solamente online, ¿ok? Podemos hacer citas online, toda la información la pueden tener a través de nuestro Facebook, Instagram o bueno, a través de esos 2 canales, al WhatsApp que lo tienen también en la página y el número general. Saludos desde Bolivia, Mariela y L. Sí, estamos aquí a través del YouTube con muchas personas que nos están. Chicos, la doctora dijo que haría un live en inglés. Benji, ok, Benji, listo, es la gente del marketing, genial. Ok. Mariela, hola desde Ecuador, me gustaría su asesoría ya que su trabajo es muy reconocido. Sheila Santos nos dice que el inglés es perfecto. Bueno, he vivido en Estados Unidos y también en otros sitios, así que he vivido en Estados Unidos porque me he ido a practicar muchas veces cirugía plástica en otros países y en otros hospitales del mundo y ustedes saben que el inglés es universal, entonces todos tienen que hablar súper inglés, así que o si quieren clases de inglés también podemos dar las clases de inglés. Ok, español, Carla Picado, puedes hacer tu pregunta, Carla, en castellano, no hay ningún problema, la contestamos. Ajá. Úrsula García nos dice que no puede hablar inglés. Úrsula García, déjanos tu comentario en el idioma que tú quieras, no hay problema, te contestaremos, no te preocupes. Ok, a ver, vamos a ver, ¿qué más tenemos por aquí? A ver, Juliana Méndez, a ver, bueno, vamos a ver si tenemos aquí algunas preguntas. Nicaragua, nos están viendo de Nicaragua, del Paso, ok, vamos a ver si tenemos aquí algunas preguntas. En Instagram, dice, quiero cotizar una cirugía de abdominoplastía, nos pregunta Javiera. Javiera, sí, mira, tenemos, si quieres haznos la pregunta por el inbox del Instagram y automáticamente te vamos a pedir, si deseas fotografías, enviarnos fotos, o también puedes hacer una videollamada, se te va a dar la información de cómo hacerlo y ahí nos ponemos en contacto porque ahorita no hay consultas en vivo, ¿sí? Vamos a ver si tenemos otras preguntas. ¿Cuánto cuesta la otoplastía? Bueno, la otoplastía, para los que no saben, es esa cirugía en la que las orejitas las tienen un poco abiertitas, ¿ok? Y hay que juntarlas, hay que pegarlas a la parte posterior de la cabeza y también cerrar un poquito el lóbulo de la oreja. Los costos van según el tipo de cirugía que se va a realizar, ¿ok? Entonces es muy importante que veamos el caso. Acuérdense, siempre que estemos haciendo preguntas sobre presupuestos, tenemos que hacer la evaluación del caso, porque no podemos dar un precio al aire, no sabemos cuál es el caso. Por ejemplo, simple, en el caso de otoplastía, me ha tocado pacientes que de repente solamente tienen el lóbulo, esta parte que está acá, esto se llama lóbulo, ¿ok? Esta cosita. donde ponemos el arete, ahí, eso se llama lóbulo. De repente solamente el lóbulo es grande y el resto de la oreja es normal. Entonces no van a pagar el precio de una autoplastía completa, solamente se paga la corrección del lóbulo. O de repente hay pacientes que solamente tienen que formar esta cosita de acá, ¿no? Esta cosita de acá que se llama antihélix. Este borde que tenemos acá se llama hélix y este que tenemos acá se llama antihélix. Entonces de repente solo necesita formar el antihélix y la formación del antihélix, simplemente esto es un procedimiento pequeño, entonces no necesita una autoplastía completa. Entonces es muy importante entender eso, ¿ok? Yo me voy a despedir del live del YouTube, ¿ok? Nos quedamos con las plataformas de Facebook y de Instagram para contestar las preguntas. ¿Ok, chicos? Ok. Entonces, y vamos a cambiar esto por acá. ¿Ya? Entonces, bueno, lo que estábamos hablando es que básicamente necesitamos las fotos para poder tener la cotización. ¿Ok? Cotización. Silvia Veloz Mejía nos dice, me gustaría enviar fotos para la cotización. Silvia, envíalas al inbox. En el inbox puedes enviar fotos, comenta qué es lo que deseas. Email no. Yves Quintanilla, email no. Es muy difícil contestar el email. Tenemos el Instagram inbox, el Facebook inbox, el WhatsApp que está en la página, el teléfono. Tenemos todo para que puedas enviar tus fotos, por favor. ¿Sí? Ahí dice, Cecilia Fernández nos está preguntando que su altura es de 1,50 y su BMI es de 30. Perfecto, excelente trabajo. Una de las cosas muy importantes es hacer que ustedes mismos comiencen a hacer el cálculo de su índice de masa corporal. Genial. Gracias, Cecilia. Eso quiere decir que nos estás siguiendo en los posts que estamos haciendo. Te felicito. Si todas las pacientes hicieran eso, ya sabrían que si tienen un índice de masa corporal por encima de 35, no son tan candidatas para cirugía plástica, ¿ok? Entonces, eso es muy importante, entender eso, ¿sí? Tenemos varios posts en el que lo hemos comentado. Con 30, Cecilia, sí te puedes operar. Envíanos tus fotos por inbox y te hacemos una valoración, ¿ok? ¿Cuánto cuesta la reducción de mamas? Todo es importante enviar fotos, sí, para todo lo que es presupuestos. Implante de glúteos, si se utiliza anestesia general y cómo es el postoperatorio. Y con esta pregunta ya nos vamos, ¿ok? El implante de glúteos es una cirugía en la que uno puede bloquear exclusivamente las raíces posteriores y en la zona dorsal y lumbar. Entonces no necesitamos una anestesia general, puede ser una anestesia raquídea, ni siquiera epidural, ¿ok? Dura 1 hora y media y con eso prácticamente estamos terminando la cirugía. El postoperatorio es de 2 semanas que el paciente no puede caminar, tiene que estar boca abajo, ¿ok? Katy García nos pregunta que quisiera saber si con una lipo y mini-tuck quedaría bien o es necesario hacerse la full abdominoplasty. La diferencia entre mini-tuck y la abdominoplasty, the difference between the mini-tuck, tummy tuck se le dice abdominoplastía en inglés, ¿ok? Entonces, mini-tuck es una mini abdominoplastía. Entonces, la diferencia entre el mini-tuck y el full abdominoplasty es básicamente la longitud de la extensión. Entonces, lo que tú tienes que hacer es enviarnos tus fotos para ver cuál es el caso. Porque si la longitud del panículo va de cadera a cadera, no hay forma en que yo te pueda hacer un mini tummy tuck. Eso no aplica. Tendría que ser un full, porque si no te van a quedar las orejas de perro, ¿ok? Pero eso lo tenemos que evaluar viendo el caso. Es muy importante que nos envíes tus fotos y ahí te damos la respuesta que queremos, ¿ok? ¿Ya? Entonces, bueno, yo creo que dejando todas las preguntas que quieran, ya estamos a 30 minutos del vivo, ¿ok? Es muy importante que nos sigan escribiendo y escríbanos al inbox si es que están interesados en atenderse con nosotros, saber un presupuesto, y les dejamos abierta la posibilidad de que puedan tener una consulta por video llamada, ¿ok? Así que bueno, que tengan un lindo día. Ya sabes que tenemos 15 días más de cuarentena, así que a cuidarse y les deseo que todos estén sanos en casa. Cuídense, cualquier cosita les estamos respondiendo. Hasta luego. Mm-mm.